Hello friends, I am back with yet interesting case to be shared, a case of dengue fever with jaundice which was cured in 3 days very nicely with a single dose of homeopathic medicine. I was very much excited to share this case with you, to share the approach, to share the thinking process. Before I narrate the case, there is a disclaimer that this video is only for learning purposes of homeopathic doctors and practitioners and not for general public. This remedy which is mentioned in this video, kindly do not use as a specific remedy for dengue fever. Please consult homeopathic doctor, give your stress history and help your own self for your treatment, because if you don't give proper history, it is very difficult to give result. Yes, back to the case. This case of a young male patient, he came with fever and chills around 102 103 degree temperature. He was having chills, not able to eat properly, malaise, body ache, not comfortable feeling. After 1 day of fever, he came to me the second day and immediately I sent him for blood workout in which NS1 was positive, slight jaundice was also present, SGOT, SGPT was also raised, platelet count was reduced. He was very anxious seeing the report because there was some incidents where one of the family member was sent to ICU because of dengue fever, so he was very anxious, but he was having very good faith in homeopathy and in me. He said, "Sir, I want the treatment." So I asked him, what disturbed you, why you became ill, what was the stress before your illness? See, you cannot grow roses in desert, you cannot grow cactus in a very moisturized environment, in a soil having high quantity of water. So dengue virus will not replicate when there is a proper background or when there is a proper soil. Then and then only the dengue virus will replicate. So what made this dengue virus to replicate? When the mosquito had bitten, what was your immune system doing? The immune system had to immediately handle the situation and remove the virus. Why was it silent? What made the immune system silent? This should be our thought process. So what happened? He was doing a job in a private company. 1 month back, he resigned and started his own company, and the first client was a foreign client. He finished the job of this foreign client. After finishing the job, after 7 days of finishing the job, he landed up in this fever with chills. So I asked him what happened in these 7 days. So he said, "Sir, number one, this job I had completed and I had given my bank details for payment in faith, in trust. But this fellow, the client, the foreign client, was making excuses. He was postponing my payment. He said, I will do, but tomorrow, day after tomorrow." So he was postponing his payment. So he became anxious. I have shared my bank details. What if there is a online fraud and all my money which is there in the account vanishes? So he transferred all his money from his account to someone else's account. So there was extreme anxiety, there was extreme fear. Second thing, this client may declare me as a fraud because I am here and he is there. I have done his job. So the burden is on me. So I have to take the payment. Because I am poking him again and again, he may declare my firm or myself as a fraud, extorting money. So that fear, anxiety, it further increased. So after this, he landed up in NS1 positive with jaundice. Now try to understand why. Number one is the organ involved. Number one is the liver, and number two is the platelet. What is the role of platelet? Platelet functions as a plug to counterbalance the bleeding from the blood vessel if there is any injury. Platelet first comes into play. And what is blood? Blood is a vital fluid. Okay. This correspondingly, what is the thought process going on in the mind of this patient? That my liquidity, my money may leak away. There are chances that it may be taken away, it may be snatched. So what is money? Money is your vital liquidity. Money represents your stability of future. Okay. So when there is a chance of something being leaked away, which is there in the mind, so body will react in this fashion by reducing the platelet count. So this is why there was thrombocytopenia. And why liver? Because what is the role of liver? Liver acts as a source of storage of energy currency. Glycogen. What is the role of glycogen? Release of glucose when you are starving, when you are fasting, in order to give you energy. And what is money? Money is again your reserves for future use. So here both the conflicts, that I am going to lose my money. Second, I am going to lose my vital information, my vital bank details to someone. So that fear was there. Correspondingly, the body reacted in this fashion by reducing the platelet and manifesting jaundice. So what was the rubric taken? So there were two rubrics which I took. Number one is delusion, injury about to receive. Number two, why injury? Because he had thought that my amount or my money will be gone because of certain fraud. It can happen. It was so strong that he shifted the whole amount to someone else's account. So he had a fear, and because of fear, he did some action. So this is the delusion. Delusion, injury about to receive. Second thing is, he had given in faith the amount, the bank details to the foreign client. Fear of being betrayed. These two rubrics I had taken, but to my surprise, again there was a twist. If you repertorize in complete repertory, the only remedy coming is hyoscyamus. Because in complete repertory, fear of being betrayed, lysine and hyoscyamus, only two remedy are mentioned. Whereas in synthesis, Treasure edition 2009, 7 remedy are there. So because the patient had sensitivity to tight clothing, so I prescribed him lacasis 1 ml single dose. After that, immediately he started feeling better mentally as well as physically also. He started eating, fever reduced even, and it did not come again. He was so much anxious. So after 24 hours, I repeated it. The platelet count slightly raised, 20-30,000 it was raised. It came down in the normal range. After third day, again I checked NS1 and LFT and all. So everything was normal. LFT was reduced. Because SGOT and SGPT, they are chronically slightly elevated in the reports which I did before also. So 10-20 units for him is normal, because SGOT and SGPT were 20-30 units. It is always coming out above the range. So this is a normal phenomena for him. So it was around hundreds. So it came down to normal. SGOT and SGPT. NS1 became negative, platelet became normal. So this patient was better in just 3 days. I'll post the before and after report just for your reference. So friends, this kind of approach you should use for such illnesses. For each and every case, try to find out why the platelets are reducing, why the immune system was silent. Try to find out answers, try to form the rubrics from the perception of the patient, and you will get miraculous results. Thank you.